All right, so let's shift our focus now. You may know ALS by its more popular nickname, Lou Gehrig's disease, but did you know ALS can strike anyone at any time and that this cruel disease of the nervous system is not in fact linked to family history?
Yeah, when ALS takes a life, it most often is a case of a patient no longer being able to draw in any oxygen, breathe, basically. May, of course, is National ALS Awareness Month, and this morning we are getting more details on the Take a Breath campaign. We are joined by Dr. John Coleman. He is the pulmonary and critical care specialist. Good morning to you. Thank you for coming on.
Good morning. Thank you for having me.
Oh, we're glad you're here because a lot of people would find this very interesting and want more information. And you've spent a lot of time this year working with COVID patients in the ICU, and in a lot of cases, they just couldn't even breathe. I want you to talk about the message that's behind this Take a Breath campaign.
Absolutely. So, again, thank you for having me. The world changed in March of 2020, right? All of a sudden, COVID was here, and there was this fear of not being able to breathe, ending up on ventilators, something that was real and started to impact people's lives on a daily basis. This is something that people living with ALS have always struggled with. And so the Take a Breath challenge was to really take a moment to appreciate the ability to breathe. Breathing is something so essential for life, something that we do over 20,000 times a day that we take for granted. We don't really appreciate the ability to breathe until we can't do it. And so what I really wanted to do was put a focus on taking a moment to appreciate the ability to breathe in honor of those people who are living with ALS.
Yeah, and to that point, you have a personal ritual, which is pretty cool. You climb onto your Peloton in honor of those patients. What was it exactly about that struggle that inspired you to pedal in their honor?
So it was funny. One day I was on the bike riding, and I was just really breathless, and it really made me have a moment of being like, gosh, I treat all these people living with ALS. They're my friends, they're my patients. And I really had that moment where I was like, this is what they struggle with. And so, on all these months that are in honor of people, whether it's cancer or something else, I find that it really hits home when there's a personal story. And unfortunately, there's not a lot of people who have known someone who's been touched by ALS. And so what my mission was this month was to really give that personal connection. So every day I get on the bike and I ride in honor of someone who I've cared for, a friend living with ALS, in honor of their memory, to really make it personal so that people feel connected to a mission of finding a mission to create a world free of ALS.
Do we know why ALS hits so many people later in life, and men more so than women?
Yes, it is. So, like you said, you guys had some great information at the beginning of the segment that ALS is more commonly a sporadic disease. There is a genetic component to it, but it can affect anyone at any time. There's no racial predisposition. There's no age predisposition. There are some factors that lean more towards men over women in cases, and usually later in life. But it can affect young people as well.
Well, John Coleman, pulmonary and critical care physician, certainly such an important topic. You keep pedaling, sir. Thank you so much for your time this morning. Appreciate it.
Thank you for having me. You guys have a good day.
All right, you too.